morning, everybody. Everybody's so well behaved, it got just quiet. I don't even need my gavel, which I'm finally learning how to use. So anyway, good. I call to order the September 24th meeting of the Special Committee on Academic Health.
It's not
the
September
University of-
24th.
Yeah, exactly.
Wrong date.
Yeah, oh, it's September of 24. Of 24. Yeah, thank you very much, Chair.
Yeah.
This is why we need a chair. Keep me in line. So I want to thank everybody for joining us in this West Committee room. Today's meeting is not being live streamed, but the recording will be uploaded and archived to the board's YouTube channel after today's meeting. Quick reminder, as we usually say, that the West Committee room has room-wide microphones, so please make sure you are projecting while you speak, and I'll ask those in the audience to limit side conversations as well. So today we have basically two agenda items. One is we want to review the work plan for this special committee on academic health. And then we want to go to what was really tasked by the governor's task force is to really get an update on the interprofessional strategic plan by all the health science schools. So we're anxious to have that update as well. So with that, let's move to our first item this morning, which is a discussion of the 24-25 special committee work plan. Vice Chair Ruth Johnson and I developed this plan, working this summer, and the board's 24 and 25 priorities, and with extensive collaboration with President Cunningham and her team, including Vice President Toller, and along with support from the board office, all of which was extremely appreciated. As you can see, the work plan includes topics that will help build our understanding of academic medical centers and the clinical market as well. We have also planned a series of discussions on the health sciences across the state. So to highlight the statewide partnerships and how the university is serving Minnesota across our system. I want to note that this work plan is flexible, and we have intentionally left space for additional updates for mHealth Fairview and the university's academic and clinical enterprise. The special committee will be ready to engage in those conversations and provide guidance to President Cunningham and her team on this really highly consequential topic as those items develop. With that, I'm going to turn to Vice President Toller and see if there's additional comments you'd like to make.
Thank you, Chair Wheeler, Regent Johnson, Madam President, members of the committee, and everybody else. And we have an arrival, that's good.
Sorry, I'm used to always being in the
That's
other room.
okay, that's okay. We are very friendly here. This committee, of course, is going to be a tremendous part of what we are going to do, and is going to be the key element to execute on the strategy, execute on the mission. And I'm profoundly grateful to everyone who has put it together and made it a reality and made it right time occurrence and experience, because this will be a incredibly consequential year for healthcare. We all know that. And we are, as Regent Wheeler said, we are poised, we are ready to develop this in a way that we can change and flex, as we go forward. Any strategic plan that I can think of that is of any use is actionable, because as we all know, the intentions matter much less than the outcomes. It is an aligned one. As Regent Wheeler said, there is going to be a clinical enterprise plan, and there is a presidential strategic plan under development. So these have to all come together, and it has to be an active document, because it has to be possible to change it as we go forward, so we can adapt to the situation on the ground and fit some of the strategies into the ecologies that we will become reality. Now, we have scheduled several of the deep dives into the university system, into the marketplace, and these all will dovetail so that we can have continued progress on the strategic plan. What we will do throughout the year is to bring together all these parts so that they, again, cohere and coalesce into a clear narrative of what we are accomplishing and what is the vision where we're going. And we will have succeeded if we can create excitement, develop directionality for our plan, and find and execute on the solutions for the state. Madam Chair.
Thank you very much, Toller. Any other comments or questions from the committee about the work plan? All right, seeing none, we got it perfect then. I think that everybody's keying off the word flexibility, so that's good too. All right, thank you very much. Well, with that, we'll move to our, quickly to our second and more substantive item. It's to hear an update on the joint strategic plan for the university's 6 health science schools. Today's discussion will provide the special committee an opportunity to give feedback on the framework for the draft plan. And based on that input, the final plan will return to us next month as we move forward on formal board endorsement. Before we begin the presentation, it's important to highlight that today's item focuses on the objectives and components of our health science schools. Not included today is how the plan will be influenced by our clinical partnerships. The implementation of the strategic plan will certainly be influenced by our continued discussions with Fairview and other clinical partnerships that we have across the state. As those conversations come into clearer focus, the special committee will take up topics that will help us show how our academic and clinical enterprises and partnerships will interact and align with each other. I'm sure I speak for the special committee when I express how much we were looking forward to those two parallel processes intersecting and showing us a comprehensive strategic plan. Finally, I'd like to point out that the fiscal year 26-27 biannual budget request of the state of Minnesota is up for review in Finance and Operations Committee later today. It includes funding for the implementation of the Health Sciences Strategic Plan as it currently drafted. I'll have to say that I was really excited to see this plan and its four main components embedded in the Finance and Operations request as well. With that, here to present this item are the University Health Sciences leader, Dean Connie Delaney of the School of Nursing, Dean Keith Mays from the School of Dentistry, Dean Laura Mulgard from the College of Veterinary Medicine, Dean Melinda Pettigrew from the School of Public Health, Interim Dean Amy Pettinger, welcome Amy, from the College of Pharmacy, and Dean Toller from the medical school. We so appreciate joining them as Rochester Campus Chancellor Lori Carroll and Executive Vice President and Provost Rachel Croson. Provost Croson, would you like to start us off?
Thank you, Chair Wheeler and members of the special committee. It's my great pleasure to join the deans of our 6 health sciences schools, plus the chancellor of our Rochester campus, to share with you our current iteration of the health sciences strategic plan. I want to also especially welcome Dr. Amy Pittenger to the table, who has generously agreed to serve as interim dean of the College of Pharmacy during this academic year. The strategic plan is designed to build on and respond to the work of the Governor's Task Force on Academic Health at the university. You've seen previous iterations of this plan back in May and in June. Since then, we've collected feedback across a broad variety of stakeholders, which we've incorporated into the plan that you see today. There are also other changes you will see from our previous presentations. First, we've developed a vision and a mission and an overreaching goal. We all know how important a shared vision is, and we felt that this addition really helps to motivate and synthesize our activities. We added some structure. So in addition to the shared vision, mission, and goal, we have 4 initiatives. Each one has actions and metrics nested under each one. Third, we did some reframing. We wanted to focus less on what activities we were going to do and more on the impact that those activities would generate for the citizens of the state of Minnesota. And so you'll see as we walk through, as each of our initiatives and other language throughout the plan begins with the impact and then describes the actions we will take in order to achieve that impact. And then finally, as suggested by President Cunningham, we developed a Volkswagen version based on our legislative ask in the biennial budget request, which, as Chair Wheeler indicates, is $45 million recurring. That's one of many parts of the ask. And a Cadillac version of what we would and could do if we were to have access to additional funding, and in one location, even a potential capital request. So with that, I'm going to turn the presentation over to Dean Tolar, and we'll all be available for questions and discussions.
Thank you, Chair Wheeler, members of the committee, Provost Crossan. As Provost Crossan said, we did come around the vision for the state of Minnesota that we believe that Minnesotans share, and we believe that this is inclusive not only of us and health professions, but really all the communities that are represented in the state. The mission that is layered under this is within this plan, and it's really looking at how do we become the healthiest state of the nation. You may have seen the Becker's ranking that has ranked Minnesota #1, and we like to be #1 in healthcare. But as we all know, health is not synonymous with healthcare. So we have lots to do in the intersection of the number of different parts of the health itself. And I love what President Cunningham started, which is understanding health broadly. You know, health is about many other things outside of the clinic and operating room and floors in the hospital. We are unique, and we never tire of saying that because it's important to have something that's a value proposition for the state of Minnesota. We are unique and among the 4 other places at the universities in the United States that have all the 6 health science schools together and working very well together. And in addition to this, we have a MIT and Caltech level College of Science and Engineering. We have a business school. This is very innovative, and we have a very strong agriculture program. So we are poised in a way that is really a unique opportunity, and it creates this opportunity for our graduates. This creates an opportunity for our faculty and our practitioners so that we can actually connect across areas of expertise, which can be physical health and mental health. We all know that there's no health without mental health. We can connect across going to Dean Mulgard's One Health clinic across the human and animal health. We can connect across the health of the people and health of the planet. We know very well that climate changes have been significant impact on the health of communities and states and people individually. We have seen new pathogens emerging, like with COVID-19, and we have seen pathogens that we have known all along that are distributed across very different geographies because of the climate change. So we are, as a university, truly unique in a way how we can respond to all of this. And we need to be also able, on a more personal and professional level, move past the several letters that some of us had behind our names and not look at the degrees as the end point in what we are trying to achieve, but rather knowing that our graduates at this university in any of the health science and other specialties will be looked at as advocates and leaders in their respective communities in urban or rural setting and anywhere else. So this is something that we are, I think, obligated to play a major role for the state of Minnesota. But as Provost Crossan said, we will not do this alone. We never thought of doing this alone. So we are very intentional about collaboration with the state, with the healthcare systems, with the communities, with the higher education colleagues, so that we end up with the top quality care. We do all of this now, but we can do much more because we have all of these resources, and we are ready and eager to move in that direction. Next slide. We have divided this goal into the 4 areas, as you see on the slide. The first one is access, that requires that we address the current and looming workforce shortages. The second is that we will reduce inequities in care in partnership, again, with other players to reach some of the rural and underserved communities. Third, we will improve the outcomes in healthcare closer to home, and then we will continue to innovate in healthcare so that we can do this with prevention, with treatment, with care models, and so forth. So I will now ask my colleagues to add additional information about how exactly we will do this. And let's start with Interim Dean Pittenger. Amy?
And we can do this because we are excellent. We're really proud that the University of Minnesota is well recognized in excellence in many different areas. You can see on this slide that our School of Dentistry is ranked 16th. Our medical school is ranked 1st in family medicine, 4th in surgery, 7th in pediatrics, and 15th for most graduates practicing in rural areas. Our School of Nursing is ranked 3rd in midwifery, 8th in the Doctor of Nursing practice, and 16th in the Bachelor of Science in Nursing. Our College of Pharmacy is ranked 6th, and while not listed on this slide, I also want to note that our college also includes the university's well-ranked medical laboratory sciences and occupational therapy programs. Our School of Public Health is ranked 12th overall, and our healthcare administration within the School of Public Health is ranked 2nd in the country. And our College of Veterinary Medicine is ranked 4th in the United States.
I'd like to follow up with the beginning deeper dive, if one might say, into each of the 4 objectives. So the first one, as Dean Toller mentioned, expanding access by reducing the healthcare workforce shortages statewide. So as you know, the university graduates roughly 70% of most health professionals in Minnesota. And yet, we have shared over and over that our state faces a critical shortage of healthcare providers, actually across all healthcare providers. Our university plays a unique role in training the next generation of health providers. So we will increase the number of professionals that we train and graduate and ensure that they are prepared to work effectively across disciplines and to utilize advanced technologies. Thanks, Laura. More specifically, as you review this slide, you will see what some of the numbers, metrics look like. With requested investment from the state of Minnesota, we would collaborate with the Minnesota Department of Health to identify unmet needs and increase class sizes in workforce areas experiencing shortage. You see itemized here the specifics of some of those areas. 240 doctors, 200 veterinarians, 650 nurses, 400 public health practitioners, 800 patient care specialists, and 240 pharmacists, along with 200 oral health professionals. So with this, itemizing some of the few specifics related to Objective 1, I will transition to Keith Mays to address Objective 2.
Good morning, Regents. And our next objective, and very important objective, is to reduce health inequities by expanding partnerships and to rural and other underserved communities. We're committed to serving the entire state of Minnesota, especially rural and other underserved communities. Providers from these communities and health professionals who are trained in these communities are more likely to continue to work in them. We will enhance our partnerships to organizations and providers to ensure all Minnesotans receive high-quality care by highly trained health professionals. With requested investments in the state of Minnesota, we could integrate curriculum and experiential learning focused on rural and other underserved communities into current programs and address barriers such as preceptors, clinical sites, and housing to facilitate more placement in rural and other underserved areas. We could measure these actions through launching new curriculum and experiential learning by fall of 2025, as well as increasing the number of health science students' placements in rural and underserved areas year over year.
So I'll cover Objective 3, improve healthcare quality close to home. As Dean Tolar said, we can't be satisfied with the current state of affairs in this state, where many of our citizens don't have access to healthcare within reach, whether that's healthcare for themselves, their family members, including their furry family members. Every Minnesotan deserves access to the right care at the right time, especially in times of great need. And the university, as we've, I think, made the case, is uniquely positioned to improve the availability and quality of healthcare across the state, both through our own healthcare professionals and by supporting other systems through education, research, and partnerships. So with the requested investments from the state, we could expand mobile health and telehealth services in partnership and consultation with local communities. And we can pilot the One Health Clinic that I've talked about before that will offer care to both people and their pets. This integration of veterinary and human medical services has been proven in another state to increase access and improve the health of the family and the communities. And we can measure the impact of these actions through the number of patients served through mobile and telehealth and the evaluation of this One Health pilot. I'll now turn this over to Dean Pettigrew.
Thank you, Dean Mulligard. So I'm here to talk about objective number 4, and our fourth and final objective is to transform health outcomes through innovation in prevention, treatment, and care models. We are Minnesota's research engine, and the university continues to lead in prevention and healthcare innovation. We've pioneered the first heart-lung machine, to developing the breakthrough HIV treatment, abacavir, to culturally competent, evidence-based, and integrated dementia care in the community. We drive the health of people and communities across the lifespan. Next slide, please. With requested investment from the state of Minnesota, we could launch new targeted interprofessional and multidisciplinary research into prevention, treatment, and care models and cures for one high-need condition. This would be determined in collaboration with the state. We could also translate research innovations into practice by expanding our community connections. We would measure these actions through establishing 2 new industry partnerships or startups and translating 2 innovations to communities throughout the state using Clinical and Translational Science Institute and the Learning Health Systems Science Initiatives.
So there is no time to waste. There are shortages of the workforce that are not just quantitative, they are qualitative. As we know from healthcare systems, especially from our own mHealth Fairview, the capacity in the hospital and the clinics is not the shortage of the physical capacity, the rooms. It is the staff that we have to perform what we need to have in the clinical enterprise. Second, it is geographic. It's the maldistribution of the healthcare professionals that we have. And we all know that the state of Minnesota, even though the Beckers, I'm glad that we are #1 in healthcare, but we have healthcare deserts. You know, if you go north of Duluth, if you go to northwestern, southwestern Minnesota, this is long distances that families need to travel for care, such as OB care. And then you have a population that's aging. We are on the cusp of being one of the states that will have more people older than 65 years old than younger than 18 years old. And that is affecting the healthcare providers as well as the population that they serve. And on top of that, you have the reimbursement models that are truly not incentivizing the right behavior. You have new technology that is not yet set up in a way that is interoperable. And you have new expectations, as people should have, expectations of who their healthcare providers are. So if you take this all together, we are going to have to do things differently than we have done them before. And I look at this as this fragmented environment that it has to be brought together, and somebody has to reintegrate this. And we are probably the only place in the state of Minnesota, in the society in general, as a public university, that has the energy and the experience and the will to reintegrate these things together. So I see this as both as an opportunity for the university, but even more importantly, the responsibility of ours to be the driver of that transformation, because it's necessary now and there's no time to waste. And I'll hand over to Chancellor Carroll.
Thank you. In conclusion, the university's health sciences strategic plan aims to address the critical healthcare challenges facing Minnesota by, and there are 4 things, I wonder if you can name them yet: expanding access, reducing inequities, improving care quality, and importantly, driving innovation. Through collaboration, dedication, and a shared commitment to health, we will realize our vision and continue to lead the nation in health. We look forward to your input and comments today, and thank you, Chair Wheeler and members of the special committee. Thanks to President Cunningham for adding the university's health sciences campus to this group. UMR is glad to be included. To be clear, this is the team that did the work, and we're looking forward to further collaboration and partnership in the future. So happy to answer any questions you may have.
Great. Thank you very much. This has come a long way, and I appreciate it because all of you represent, the expertise and the possibilities for us. So really appreciate that. Want to see what questions people might have or comments. Let's start with Regent Turner.
Thank you. Thank you, Chair Wheeler. First of all, I appreciate your goals. I especially appreciate the goals in regards to increasing the health science workforce. Being on the front line, I'm up front and close with that. So I appreciate your very ambitious goals. I've kind of heard different things about innovation and research, and I would think all this plan, PR and communication is going to be a part of it, getting our name out there, et cetera. I'm going to digress just a smidge. Hopefully, when I became regent, one thing I did right away to try to get up to snuff in the role was to go to a couple of the county fairs and see this driven to discover on a stick kind of thing. And I went to both Stevens County and Beltrami County. And one thing I noted in Beltrami was that everyone was wearing North Dakota State University paraphernalia. And we were barely recognized, okay, in Western Minnesota. Two thoughts came to my mind. We need to get a booth to sell U of M paraphernalia. And then we also need to increase our presence in the different county fairs. Now, the one thing, and it was very enjoyable to see all 5 of the displays, et cetera, and I listened intently to all of them. This summer, much to my disappointment and this didn't exist in the counties. And I'm wondering if we are still going to do this program. I get it, we have it at the fair and you get more people and all that, but if we want to truly show Minnesota that our land grant mission is to represent everyone and to be there for everyone, we need to be, I get it, you don't get as many people at these county fairs, but you can't tell me that the research that's done across the state isn't important. And it's important for us to be out there. So I don't know if this is a part of the budget here, but I hope to see this come back again. It sounds like they ran into a budgeting the way they used to pay for it. And it sounds like maybe 200,000, which in a billions of dollar operation sounds like peanuts, would be able to keep this program going. And I would be very disappointed if it wasn't.
Can I speak to
Can I comment on that for a moment?
Sure.
I was really impressed when I went to the state fair this year and I saw the Driven to Discover booth, and I just really want to commend the team and Aaron's team. And as I understand the amount of, I've never seen anything like that across the country, in which we are able to not only engage with the public all the ways across the state fair, but to see how we're actively enrolling. As I understand, many of our clinical trials in that Driven Discover are enrolling half or more of their population from all over the state. So when I hear the question about, it seems like about how we could do replicate that same model in other state fairs or in other county fairs and things. So I think the clinical trials groups are always looking for ways to continue to expand their enrollment and opportunities. I understood that some of them were in some of the other fairs around.
Right.
And Jacob could maybe speak to that. And I think that's a broader component of the research work and how we do great research that I'm sure the team would be willing to think about how we continue to increase our enrollment across the state, because all clinical trials want to enroll the most diverse population and the people from all over the place that they possibly can. And I don't know, folks that have been here longer can maybe speak to the clinical trials, but I just wanted to say how impressed I was with the Driven to Discover at the state fair, and how they replicate that model other places is important.
Chair Wheeler, if I may just add just one, is that it was also very much noted that we weren't there. And we did, when I went to the celebration the other night on Tuesday for the 10th anniversary, I had a lot of feedback from the people who live in Western, some of the professors who said it was noted that we weren't there. So with that.
Thank you. Want to make a comment?
Chair Wheeler, Madam President, Regent Turner, because, I was called,
Right.
to make a comment. So the trials across the state of Minnesota are truly coordinated from here. It started with oncology. We started with Mayo together. We have the Minnesota Cancer Clinical Trial Network. We've established it about 3 years ago. There are 18 sites across the state of Minnesota that have exactly the same protocols, trials, standard of care as we have here in the Twin Cities. And the disequilibrium, and this was a major, major push forward. As an oncologist, I can tell you that the incidence of cancers across the state is about the same, and the survival is about 20% better at Rochester and in Twin Cities. Absolutely unacceptable. So that's why we have done this. I don't know whether they are at all the county fairs or not, but I can tell you that we spread it across the professionals that are actually on the receiving end of the trials.
Great, thank you, Jacob Toller. I will go to Regent Verhalen.
Thank you, Chair Wheeler. There was one word in particular that Vice President and Dean Tolar used that I think was really indicative and we should really pay attention to, which is the word fractured. It is very easy to focus on what you're doing, how you can do it, how to do it the best you can. It is often more challenging to pull yourself up a little bit and say, okay, what am I doing that the person sitting next to me is also doing, and together we can make an exponential difference. And I really appreciate that each of you have taken the time to have those conversations and really start stitching those pieces together in a really meaningful and purposeful way. There needs to be that type of foundation for any sort of strategic plan like this with these 4 key metrics and goals to advance. And the one thing I will say is just make sure we don't keep talking to ourselves about it, that we keep pulling up and finding opportunities to spread those threads even further, because it is one thing to talk about the work that we're doing, talk about the opportunities. It's another to talk with the right people and the right places about those opportunities and the things that we're doing, because you have to have the audience there who is interested in those things and finding that hook. And I think those will be the next biggest challenges in implementing this work. And I don't say that to be doom and gloom and Chicken Little, but I say that these are the things that I'll be looking for as this moves forward, and really looking to all of you on what we need to be thinking about to help support that, whether it's financial, whether it's platforms, whether it's relationships, all of those kinds of things. Thank you.
That's great. Thank you, Regent Verhalen. Very important. I'll go to Regent.
Thanks, Chair Wheeler. Well, great presentation. I really like the four points a lot. I think one of the underlying situations in all of this is access. And when I look around, I think the problem with the system is that nobody can afford it. Okay, and so, I mean, the deductibles that are all-time highs, I mean, seniors can't afford their drugs. Anybody who has health insurance, they still have to pay the deductibles. Insurance companies aren't reimbursing. So you have one insurance company, they'll pay for a drug or procedure, another insurance company won't, and the person's on their own. I think the grandest of grand challenges is to fix the whole economics and public policy around that. So get the Humphrey School involved, get some economists involved, and fix the whole system from the ground up on the pace. So the Medicare reimbursement is right, the whole thing, the whole big picture. And then add these 4 points underneath that. And so everybody in the state, and we could be the first state that has that for everybody, not just certain people. So, and then I really like the idea of getting, I'm not going to pick on the veterinary school, but more veterinarians in the state. But we have to also make sure that we have a severe shortage of food-type veterinarians, and we have to make sure that those veterinarians are in places that we need them, that we can keep farmers in business as well. So, I mean, it matters that we have more veterinarians, but it also matters where they're at. So I think that's another really important thing. But I'm really excited that Minnesota could really lead the nation in creating not only the healthiest state, but the most inclusive and accessible state to everything you guys do. So thank you for that, so.
Thank you. Can I comment, Chair Wheeler,
Please,
Regent
please
Hampshire?
do.
So I had the pleasure just 2 days ago to have lunch with the incoming VetFast students. That's the kind of fast track food animal scholars track, which is a system-wide partnership. And I will tell you that 60% of that incoming group, which wasn't huge, but was mighty, was from Crookston. So this is a partnership that is working and that is, that we need to continue to grow, that is serving rural Minnesota.
It's a fabulous example. Thank you.
Thanks.
Good. Yes, okay, yeah, did you want to speak?
I want to comment if I might.
Yes, please. Go ahead.
Chair Wheeler. So you are absolutely right, Regent Hampshire. This is, the costs are the underlying problem in access. So the way to get out of this is not doing more of the same. The United States business of healthcare, not healthcare, business of healthcare, is a broken system, and we have known this for a while. If you look at the population in the United States, 40% Americans cannot afford $500 extra bill. The most common reason for bankruptcy is medical bankruptcy. 1 in 7 Americans have medical debts that will be with them essentially forever. So the way to get out of this is not the direct way, but the oblique way. Oblique way, what I think, is the whole person health, as the president, put it together. It's the value-based contracts. And I'm now, traveling around the state, meeting with the clinical integration networks that are independent hospitals to help them, make these value-based contracts possible. And innovation. The more innovation that's the way to decrease the costs. So we are, again, in a position to be very helpful to the state and Minnesota. Madam Chair, thank you.
Yeah, I'll just add, because I can't help it, because I've been so embedded in healthcare, that all the components of your 4-part plan are ways to decrease the cost. So yes, innovation, and yes, consistent quality of the highest level to prevent secondary complications, and yes, access to care that people don't currently have. So I think that the components hit on what actually drives affordability in great ways. So I'll turn to Chair Mayron.
Thank you. First of all, this was a terrific leap in terms of the development of the strategic plan. It was thrilling actually to read it. I'm reading it going, yes, we have a mission, we have a vision, and more importantly, as importantly, we have metrics to begin to measure it. So kudos to all of you for the development of this, and with the president and with Rachel as well. My question is, how do we get this out now? I understand it's embedded in our request to the legislature, but this is the response to the task force, what the task force wanted as a result of the work that was done by Penny and others and Jacob on the committee. How do we get this now back to the governor or to the task force and say, all right, you asked for a plan for joint collaboration to address these various needs. How do we communicate to them? Is it only via our budget request? It seems to communication about this is critical, and it's not, clearly it's driven by the money and the need from the legislature, but I think we need a vehicle to get out there very loudly about, you asked for this and here's what we are developing.
Chair Mayron and Penny and Regent Wheeler, I believe, I want to direct the question if I may, and I don't know if Jacob wants to take it or Provost Croson, about the plan to socialize this next and the next steps for communication, because that has been part of the thinking. Only the governor calls the governor's task force together, but there are ways that we can socialize in a broader manner.
Yeah, thank you, Chair Mayron, Chair Wheeler. So we have a couple of items to do between now and October when we present it to you again. The first, of course, is to integrate feedback we get here, so that's one. But also to start to bring this plan. We've already done some consultation on the input to the plan, but to go back to those people who gave us input and to say, okay, here's how we adjusted the plan based on your input, so to kind of close that loop. And then, as President Cunningham said, we're not in a position to reform the governor's task force, but we could certainly reach out to the other individuals on that task force. And I think that, Dean Tolar and Chair Wheeler and Dean Delaney, who were on the task force, are in a good position to do that and have a set of one-on-one conversations, show them the plan, get their feedback, see the extent to which they feel that this plan meets their request, which is really where it initiated. So I think promising all of that by the October meeting may be a little bit of a stretch, but certainly, if you're reviewing in October, by December, we should have all of that input done, and that comes to Regent Verhaelen's concern as well about who's the consultation plan.
So just as a follow-up, because several of you were on the task force, so you're saying the task force has now been sunsetted, it's gone. And despite their asking for this from the university, the only way that we can get back to them about what we've accomplished is to do what Provost Croson is talking about, which is one-on-one conversations with the other members of the task force. You can tell I'm like, really?
I was feeling like that's a
Governor's a
good
little
step,
busy.
and really too, yeah.
I mean, is there a way to ask the chair, Malcolm, to reconstitute the task force in order to get the report back to them as a group, and as opposed to having to do this one-on-one?
Chair Mayron and Regent Wheeler, if I may, we do have communications staff and plan. Next week, we'll have an amazing panel, which will include the chair of that task force on the panel in the morning. I've been advised by our government relations people that the university doesn't call together the task force of the governor. However, that doesn't mean that we can't have a broad, excellent communications outreach on this great plan that we have. And there is thinking about that across the communications team. I won't call them up here to the table, but in how we take this plan and these points and have them be more clear to the public at large as well as to the individual stakeholders. And they're talking about individual conversations, but some of those conversations are with people who are quite influential and have many broad focus to get that input and go back and forth. So we're also open to the input of this group broadly and how else we impact movement forward on what I think is a really great plan, which this team's worked really hard in the past month, and I just want to commend them.
So, I will say too, and so I'm seeing incredible enthusiasm about the plan, that it's hit the right marks. But I want to ask the question, we're supposed to approve the final plan in October. Is it on track? What do you see that might be missing? I think, go ahead, President Cunningham, maybe I misspoke.
I believe it's a review in October.
Review, yeah.
This was a first presentation for
In
input.
December, so excuse me, and thank you for that. That said, we want to get any questions out or any feedback out, that can influence the plan, and any questions that have to be answered between now and December. So I want to just go in that direction. Yes, Regent Turner.
Thank you, Chair Wheeler. So in regards to the plan and the communicating, et cetera, well, then our end goal before the legislative session starts is to get concrete things that we're going to then have to find, or we should hopefully find some bipartisan champion of it, because it all has to translate into laws and money requests and all that kind of stuff. So, and that has to be done ASAP before, the day after New Year's or something. I think it's going to be a longer session this time. So is that being done ASAP too?
Along with everything else.
Chair Mayron,
That's the reality.
Everything is being done ASAP.
That's my reality, is up at the
No,
Capitol.
I feel your reality.
Yeah.
So, and I think this team has felt that reality as well. What I will say is there's our government relations team and our communications team and our budget team have been working intently on how we begin to think about the active socialization that's needed for all parts of our budget, and certainly the health component of that has been part of those meetings. And there's a lot of work to do across, but you're right. So there's ways, and I'm glad that there's good feedback on the plan, and I think the feedback that we've heard, we can reincorporate. But then there's work to do on, to make sure the public understands what the amazing opportunity is here for the university to improve health. And then there's work, obviously, to be done with our state partners to have them also understand that. And so that's the work that we'll have to do over the next couple months. And ideas and suggestions and thoughts for how we, do that the most effectively. I mean, we do have a great team that's thinking and working about that, but, we'll need all the partners working on it.
Right, as a follow-up, it's just imperative that these be one-liner requests for the legislature. I mean, they're gonna want concrete interventions, to use a nursing term.
So in the budget plan that we'll present, I think later today, my days are blurring together, these are called out very specifically, and I just can't say enough. I mean, we could focus on any one of these different objectives, but adding nearly 1,000 workforce healthcare members to the state of Minnesota over the next decade that would then go on and work for decades after that. I mean, just that one thing alone would have tremendous impact, let alone all those other ones layered on. So that's in a single line, and we hope that value then will be clear as we present it.
Great, thank you. Regent Johnson.
Yeah, thank you. Just a short follow-up, nothing profound that you haven't thought of, but I think it's important as we look at the legislature and the asks that we have, that part of our strategy to the greatest extent we can is to be able to speak to legislators in a region or, in a particular area and say, what is the university doing for you in your area? So, in Crookston in northwestern Minnesota, that may not be politically as aligned, oh, let's give lots of money to the university so they can do this stuff in the cities. You get up there and you say, we're going to create more food animal veterinarians that's going to come back here and help your farmers continue their good work and their prosperity and all. I know there's a huge task in so many different kind of groups, but I think that kind of focus, as we now have focus on what we're doing and can articulate that, but then get to those specific people and say, here's what we're doing, and hopefully can win over many of them to support our asks when they know and they could tell their people back home, this is what we and I and the legislature and the university is going to do for you.
Thank you, Regent Johnson. Important. There comes Regent Hill.
Regent Hill, so is your question, are we moving the plan along fast enough for the legislature? Or is that, if it was review and action in October, could we do both, do you think? Is that?
Yeah, I think that's
Is that the question kind of was?
That's an open question.
Yeah.
To be honest, my two questions that would influence the timeline is, do we have adequate stakeholder involvement, particularly with external people, so they get their fingerprints on this so they can better accept that, and that takes time, I think. So that would be one. And then the other is that we are going to, and I'm so glad that Dean Toller uses this term too, we're going to have to interdigitate this plan with the University of Minnesota Medical Center plans and what care and focus areas we're going to have there. So that would be my concern about moving it more quickly than that. If those two things could be done, then in my mind, it would be satisfied, but I'll raise the question. You went, Provost Coulson, on the external stakeholder involvement, and do we have an adequate view? I think we've witnessed, Regent Johnson and I have witnessed the internal, collaboration that's going on. Are we getting adequate stakeholder involvement from the external beyond like the governor's task force members? That would be one question. And then the other question is, how do these parallel path kind of strategic plans related to the health and welfare of Minnesotans come together? So
maybe I'll just say a word. Thank you, Chair Wheeler. I'll say a word about the consultation. Dean Tolar can provide maybe some more specifics, and also about the integration, because that's definitely in his category. So, we've talked with health system leaders and providers, patient advocates, payers, state and federal government leaders, other higher education schools who are also providing training. So it's been a pretty robust conversation, but really those conversations were all about give us input into what should be in the plan. That is different than the conversation that says, let's close the loop. We took your input and here's the plan we have. Does it reflect what you said? Is that enough? Does it meet your needs? Those kinds of things. So I do think that we're going to need some time on that closing the loop kind of conversation. And then there's a set of people as was mentioned, who we didn't talk to the first time who were on that original governor's task force, that we should definitely engage with. But I'm also, so part of it is the time for that. I also want to make sure that we leave ourselves enough time that if we hear something really impactful from those folks, we can adjust. And I'm a little worried if we do review and action in October, we won't have the opportunity to do that. So maybe if I can propose a kind of wait and see strategy, let's see how much of this external closing the loop and new conversations we can get done between now and October. If we feel like we've gotten the input that we need and we've made the adjustments, then we could consider a quicker timeline. And if not, we could recommend review with action and possibly marginal changes between October and December.
And Regent Hips, I'll ask you and other committee members, does that seem like a reasonable approach?
Yeah, I think it is. I think we just need to hopefully the people that aren't in this committee, the regents that aren't in this committee, have a chance to go through this ahead of time. So knowing that we have the legislature coming in January and we want to be able to communicate this to our own legislators.
Dean Tolar might have some other.
Yeah.
Chair Wheeler, Provost Crossan and Regent Hips, thank you for the question. So I think it's really important that we have gone very quickly and very deep in 5 different constituencies. We went to the leaders of the state. We went to the influencers like MHA, Chamber of Commerce. We went to the healthcare leaders, and we had a great aid from the Thunheim and Associates, and we received a report that I think that this committee, is maybe interested in knowing what it is. So there's a great pride around the state of Minnesota in all of these stakeholders to have us as the 6 health science schools and the additional, intellectual force in this. There is a little understanding what we do. That has been a sort of a important observation, I think. It's really complicated, even if you live at the university for like 30 years, like I do. And so it's on us to be better communicators and to have a clear narrative, storytelling, as Regent Bayhal always says, that can bring this, to bear on these individuals. We are already in the second round of the Thunheim and Associates tour, if you will, and we will get that information from these stakeholders on, what you have heard today. But again, it's important that they are considering, even from the first go, that this is a good start, but we have not arrived, that this needs really to be developed and needs to be much more practical and address clinical issues and address local issues. Thank you for bringing this up. And that brings me to the last comment on this, which is when I go to the greater Minnesota, that's the open door. You see, this is a saturated market in the Twin Cities and Rochester. Everybody knows everybody. There's some competitive, urges and impulses that are understandable. The greater Minnesota has several things that I grew to admire over the last 3 decades. And one is fierce independence. They not independence for independence sake. They just have this local connectivity to their communities that is admirable, and they are really able to deliver care that is incredibly courageous, I think, and meaningful to the communities. So there in the greater Minnesota, just to end up on your point, Regent Johnson, that's where the legislators, even come to the visits that I have in the hospitals, because it is so important for them. And that's how we get, I think, the political energy and the political will to translate this into greenbacks, as you pointed out, Regent Turner.
Here, Mayor Ann.
Just one quick question in response to Regent Hipsch's suggestion, could we do a review in action in October? I will say, based on other attempts to do that on other matters before us, there's been some resistance that people want time to absorb. So I think something that might be more realistic, even if we do the review in October, if we need a special meeting, we don't meet in November or later in October to address this and get it off the ground, may be more palatable. We have 6 members who are not on this committee and have not, unless they read the materials, they have obviously, or listen to the audio, they're just not going to have the substance that we have. So, but I'm certainly prepared to call a special meeting. I just think there will be some resistance to try and do a review in action in October. even if you all could get it all together.
That's wise. Thank you,
Yeah.
Chairman Ryan.
If I could just second that, I was gonna suggest that, but you're the chair, so that's great. I know we're not looking for more, but this is so important, so important. It's really key, and I agree, October to do it all is too much, but we can do a special meeting in November and really get on this. So we're that time and then back in December, and then when the legislators are meeting in January and back then, we're much more prepared. And I think that's really, really critical. And I do agree, and Regent Hipsch is one of our experts on this board in terms of how these areas work, and he's already doing a whole lot, but he can guide us, I think, and offer advice, because you know those communities and the nature of how things work and how things get done, and who are the kind of people we need in the room in the local areas, legislators, other county and city leaders, and all kinds of groups. Get them all in the room, get key people here, and they, like you say, yeah, we're saturated here, Rochester's, but when you get out there, it is a different story. And I have some familiarity with those communities as well, and it's just, we can do this, but we have to have the right strategy, the right people involved. And so I really look forward to what we can do next in this. It's great.
Thank you, Turner.
Off of something thank you, Chair Wheeler. Dean Toller, what you said about the communities and how independent they are and how important it is. This is a big tragedy about the decrease in access. It is so important in the clinics and the hospitals and whatever healthcare facility every small town has. The fact that so many of them have been closing, and so people have to go away from their town, away from the people that they grew up, that they, the nurses and doctors and assistants and all the people who work in a healthcare facility, who knows, they might have babysat them. Because the communities, everybody knows everybody. A lot of them are all, just like Governor Walz will say, came from a town of 400 and 12 of his graduates were all cousins. So you have they're not only linked by close community, they're linked by family. And it's so tragic when something happens, a broken hip or whatever, and now grandma is 50 to 100 miles away, doesn't recognize anyone. This is a huge tragedy for the access for rural America. And anything that we can do by bringing clinics or even mobile clinics or whatever we can do to bring the healthcare back to the towns so that they can be cared for by a workforce that they know. It's huge for recovery.
I totally, with your permission, I totally agree with you. And, it's just so important to get there, not to do the Zoom and not to do this sort of long distance. So, and that's where we learn what needs to be done. So it's not as much, to export the healthcare there, I think, just maintaining what's there. When I went to Winona, they have a memory care that they just built in the hospital because they don't want, the elder generation to be transferred, to the distances that they cannot even. So they would have a lunch with them, across the pathway. When I went to Sleep AI, there is the repetitive narrative is we want our people deliver their babies here. We don't want them in this. So there is this couple that can do C-sections and can do a lot of things in obstetrics, and the community holds on them like this, and that's what we need to protect, because they are so proud of it, and appropriately so, that they can do this on their own, and we can support the already excellent care that they deliver. And on top of everything, as I said many times, 70% of these practitioners are our graduates. They look at us, with some pride, with recognition, with tradition that we carry forward in healthcare in general.
And I'm hearing, President Cunningham, please.
Chair Wheeler, Chair Maron, if I could add to Regent Turner's comments and add a few pieces there. The access part that's presented here, I think it's so important that as the people hear this presentation, there's a lot of other conversations about our healthcare and our healthcare system and these other pieces and negotiations and such, but this is also what we're doing for health for the state of Minnesota. And It's very unusual for multiple schools to come together and create a shared vision like this. So this is really unique. I just want to raise that up as I've seen a lot of universities. It's really like the ability to work across the silos and to come up with a shared goal like this is incredibly important and sort of magical. And I think it speaks to a larger culture that we have here that really offers an opportunity for the state. I think to Regent's hip point before, like how do we get involved, the health policy and the other pieces, we'll be launching a broader strategic plan. And this is like a kernel then that also can weave into the other schools as we think about the strategic plan, because we didn't even talk about agriculture here. Dean Burr will do a lovely presentation at the panel next week. Food is health, et cetera. So we can interdigitate that. And then I think just the last point for folks to remember, the team, rightly focused on sort of, and maybe people don't like cars and car analogies, on the Volkswagen model of what we can do instead of the Cadillac, but look at the fine print, because there's great stuff there that we can do with funds, with real funds from the state that's modest. But boy, if we in the state really want to lean into this, they also provided a next level of what that funding could provide and where that could take the state. And I think, that's possible also. They rightly leaned into the top part, but look at that fine print there, because when you talk about how to develop the next COOC and bring things to the communities there, that's thought of and in the plan. We just are trying to be also realistic and provide different options for where people would like to rein in for the resources in those sort of line items.
It's fabulous. Thank you. Thank you very much, President Cunningham. I'm going to just ask Regent Verhalen, because we had at our strategic planning session in Red Wing had conversations about the urgency of this plan. And does this approach seem reasonable from your perspective?
It does, yeah, and I appreciate Chair Mayron's comments about moving things along through a special meeting if necessary. There are a lot of stakeholders at play here, and it is really important not only to gather their input as we build the plan, but to gather their input on the other side. Did we reflect back the things that we heard from you correctly? And I want to make sure that there is time for that. I don't want to be speedy just to be speedy, but it is important to be nimble.
That's great. Thank you. Thank you very much. Well, let me just repeat what I've heard today, which I think is pretty profound. And I think that bridges off President Cunningham's comment about the uniqueness of this and all of you collaborating in a way that's really unprecedented in the vast majority of the country. So thank you for that. I think we heard a plan today that everybody agrees on the components. I think you hit, at least what I'm hearing, you hit a lot of enthusiasm. We do need access. We have profound inequities that are causing people suffering. We do need to elevate the quality of care and close to where people are, to Regent Turner's point. And we do need innovation, which changes lives for the better. So, I think that from everything Dean Delaney and Dean Toller and I heard from the task force, that's hitting on the major marks. So that's fabulous. So you've pointed out what's needed, you've put it in meaningful ways, you put it in measurable ways that are doing that. I think what we think that we collectively need between here and when we come together on this plan is the concrete request that Regent Turner said, how do we quantify this and how do we look at, those two levels of modeling? I'm fine with cars, by the way. So the Volkswagen and Cadillac modeling and see, gosh, what does it really require in terms of investment? How do we line this up? Like I said before, we're already seeing it lining up with the Finance Committee and its ask. So I love that alignment going on. So the concrete request is one thing. Stakeholder involvement, we feel pretty good about that, but I really appreciated Provost Cross and your comment about this is another phase. This is round 2 where we see how people have responded to the plan, where they've impacted, but it sounds like you have a very robust and widespread plan there. We need a communication plan, and we need to see that. And to Dean Johnson's point, there has to be some regional specificity probably, so it's meaningful to the people that we're speaking to about that. And then we need to see this come together with the University of Minnesota Medical Center plans and its focus areas and its partnerships. So we need to see those plans come together. For example, questions like, What care areas do we need to focus on? Where do we need to be the destination center for certain care? Where do we partner with others on that care? That's coming on a parallel track, we understand that, but as a board, we need to see that come together and need to see the economic model that supports that as well. So I'd say, in summary, great work, a few things to be done yet, but you've led us on a terrific path. So with that, I'll see if there's other comments from the committee here. Yes.
Just a quick comment. The comments that were made earlier about the state of health insurance, my concern is we could come up with the greatest plan ever. The state could contribute to what we're asking or maybe even more. But if the health insurance continues, then this is a nationwide issue, to be such an obstacle to care. It's going to make it certainly much more difficult. And I don't know, and this is separate from this committee, but I know we have lobbyists in Washington and lobbying on a variety of issues, but this larger issue of the impact of of health insurance and how it makes it good healthcare inaccessible because they won't pay for it is, it's all about the money in the end, and it's just not from the state. It's from what's going on with the whole insurance area. And again, that's not for this committee, but if there's any way we could think about how the university, through its lobbyists or whatever, could, and I do think it clearly is a nationwide issue. It's not just a Minnesota issue. I don't know if it could be addressed, the health insurance here in Minnesota, separately from the nation about how it works, but it's an enormous obstacle, and I've been personally experiencing it right now to see how ineffective and what roadblocks it can create to accessible healthcare. But the Medicare and the private insurance carriers won't approve it.
Well, go ahead, please, President Cunningham.
If I may, Chair Mayeron and Regent Wheeler, and perhaps Dean Toller and I could think about bringing a further conversation back. But the way universities, I see, are able to intersect with this topic the best is universities are where often the innovative models in health policy come forward. So I would love to learn more from Dean Toller on what the expertise we have here on the research on value-based models. And the way I've seen that impacted is our job as a university is to provide the scholarship and the data and the models on what may work and provide that to the assortment of officials, not as much in a lobbying capacity, but simply to provide information, because universities are the great place where we study those models, healthcare, and often in the School of Public Health, but maybe in our health policy or in our business school, that's where those models often get analyzed and data sets get put forth and folks come forward and then provide data to government officials. So I need to learn more about that, but that may be a place where we can contribute, and if not, perhaps we can figure out a way we can.
Again, quickly, just comment that yes, this expertise is here. You look at the business school, that policy that we created, School of Public Health, is a powerhouse on this. Professor Parente, Professor Christensen, they are leaders, in this.
That's the way
and
we contribute
we
here.
certainly have a role to play.
I'm going to turn to interim Dean Pettinger too. We had a hand raised. Yeah.
Wheeler, we're on day 7 of my interim. My goal today was to be quiet mostly. But I just wanted to also provide that within the College of Pharmacy, we have some of the world's leaders actually in this space. Steve Schommelmeyer in particular has been called to be a part of some major federal efforts with regard to access, especially around medications and policy around payments, payment structures. And he has done a lot of collaboration with Carlson and with some of the professors and scientists that Dean Tolar mentioned. So I just wanted to throw that out there, that we do have really deep expertise, and there's important work happening. I think it's starting to have some impact federally, but it's complicated, as we all know.
Appreciate it. Thank you very much, Dean.
Can I ask a question? Thank you for that. Just wondering, and we have some experts perhaps also in the Carlson School and the Humphrey School about these things, and maybe for our understanding, so we better understand that, we could have them come and speak to our committee or the board and help us understand things better. And kind of goes without saying, but the outcome of our presidential election is going to make a huge difference in what's going to happen with healthcare coverage, right? So, I mean,
And I'll just say, I just really appreciate the conversation about affordability, because you talk about where there is suffering, there's added suffering because of the lack of affordability. So to be able to use our collective resources to look at promising models and to add to the scholarship, and then the implementation of that is going to be needed to get to One Health. So I appreciate the comments that have been raised in that regard.
one small
Go
question.
ahead, Regent Turner,
Thank you, Chair
please.
Wheel. I have one small question. I believe at the end of this legislative session, it was charged to do a study about, I would have to ask the political people, right? A study on all of the payment systems, et cetera. So where do we come into play in that? Have they come asking us about that?
You're looking at me, can I?
Yes, please.
So in the task force, there's a lot of discussion about reimbursement and, looking nationally at the disequilibrium of the commercial accounts and the governmental accounts as they flip now. So it's truly unaffordable, to do some healthcare. And there are some champions of having a more equal and equitable way of financing healthcare. Representative Liebling, her idea, it has not come to fruition, but she certainly has been not shy and about, what she wants. And she has been quite effective, in my opinion, getting us, Hennepin, and, several other players, together, on the much better financial footing. And if I may, to the point I think Chair Mayron made, or maybe Regent Johnson, there are states in the union that do actually pay for the delta between Medicare and Medicaid and what it actually costs. So you don't make profit, but you break even. So this is not like impossibility, it is possible to do.
Chair Wheeler, if I may, I want to reiterate though, our job is in scholarship and as at the university is to bring those ideas and scholarship forward with the data and the information that these schools have, right? And to present them to policymakers across the aisle and have them be able to make informed decisions. So it sounds like we have tremendous expertise here. I'm really excited to learn more about it. This health science plan certainly can't have all the aspects of all the schools, but we are developing a university-wide plan, and if this is a theme we want to expand on, then we can figure out a way to expand on that and make sure we're raising up that scholarship. And perhaps we could bring back to this committee some of the work of that scholarship of the team so that they understand it. But I just always want to differentiate what I view our role as a university is, which is providing the great scholarship and objectiveness on the assortment of opportunities and ways that different states do things and different policies and their outcomes and their impact, and then providing that information to the public at large so that they can make the best decisions.
It's well said. And I'll say as I conclude the meeting here, because I know we're out of time, but I'll say that when we get into discussion about larger things, that means you've done really well with focus on what we can do. That's the charge of this committee and the charge of you working together in the best way to raise the health and livelihoods and vitality of our community. So I want to thank you very much, because I know, and Regent Johnson and I both know, because we've got a chance to participate, how hard you've worked on this. So appreciate all the work, and I think it's a wonderful story that we'll be able to tell and actually be able to influence in terms of the impact we'll have on lives. So thank you very much. So with that, I will adjourn the meeting. Thank you.
Thank you, folks. I know